It's Monday, January 15th, 2024. We've just passed the half of this month, so the time really flies quickly. This morning I ran across this article. I've never read this article before, and I was curious about what kind of 15 lifestyle factors may affect how we would have the dementia. So let's find out why and how. And also, I am going to read this article for you so that you could listen to it whenever you drive. You can listen to my English. I'm trying to practice English by reading an English article each day, every day. So each and every day. So you can judge my English pronunciation and my English conversation skills. If you do have any comments, please go ahead and leave your comments down below at the reply section. I would be happy to reply to you. So here we go. By the way, I am pure Korean. I work for Korea Telecom KT, the #1 carrier. And if you do have a plan to open your business in Korea, be it a proprietary business, individual business, or a corporate business, you need to contact me and I would give you full consultation on both voice and data needs and security needs, cloud, AI, big data, high-end internet connection. There are a variety of internet services in Korea. You need to seek high-end internet for your business, and of course phone businesses. This article is from Yahoo News, and I think today, I don't know who wrote this article. Yeah, Carolyn Key. These 15 lifestyle and health factors may increase your risk of early dementia, new study finds. 5-minute read. I believe this will be like a 20-minute read because along the way I would stop and try to memorize good words, important expressions, cliches, and idioms, and sometimes the whole sentences so that I could memorize them and use them whenever I interact with foreigners. Loneliness, vitamin D deficiency, low socioeconomic status, and alcohol abuse disorder are just a few of the health and lifestyle factors associated with an increased risk of early or young onset dementia, early dementia or young onset dementia, according to a groundbreaking new study. Dementia affects a growing number of people globally. For the first time, researchers have identified 15 key risk factors, from gene variations to social conditions and environmental influences, that significantly raise a person's chance of developing young onset dementia. Young onset, that's a new word, right? Young onset. The onset of dementia, or young onset, right? Early onset is more better word, but young onset, right? Early onset dementia. So let's remember the word early or young onset, especially young onset. Dementia affects growing number of people globally. For the first time, researchers have identified 15 key risk factors, from gene variations to social conditions and environmental influences, that significantly raise a person's chance of developing young onset dementia. The findings, published in JAMA Neurology, challenge previous notions about the causes of the condition and lay the groundwork for new prevention strategies. Lay the groundwork, that's another good cliche, right? Good expression. Lay the groundwork for new prevention strategies. It lays the groundwork for new prevention strategies. It lays the groundwork for new prevention strategies. The study authors wrote, researchers at University of Exeter and Maastricht University, I think they are famous ones, followed more than 350,000 participants under the age of 65 from across the United Kingdom in the UK Biobank, a large biomedical database, to understand the risks of early dementia. This is the biggest, most robust, and wide-ranging study of its kind. David Llewellyn, PhD, study co-author and professor of clinical epidemiology and digital health at the University of Exeter, tells Today.com. The most important finding was that a wide range of modifiable risk factors appear to be important, not just the genetics, says Llewellyn, right? Modifiable means if we work hard, we could change the chances. What is young-onset dementia? Dementia is a term used to describe impairments in memory, thinking, problem-solving, and decision-making that interfere with daily life, according to the United States Centers for Disease Control and Prevention. Alzheimer's disease is the most common type of dementia, with more than 6 million people living with the condition in the U.S., according to the Alzheimer's Association. So dementia is a term used to describe impairments in memory, thinking, problem-solving, and decision-making that interfere with daily life. It's impairments. While Alzheimer's is most prevalent in people over 65, about 5% of patients develop symptoms before 65, aka young-onset dementia, according to the Mayo Clinic. So if you have a dementia before you reach the age of 65, your impairments are described as young-onset dementia. Certain risk factors for dementia and Alzheimer's after age 65 are well established. Some are qualities a person can't change, referred to as non-modifiable, like their age and genes. Other risk factors are more related to lifestyle and modifiable, such as smoking, physical inactivity, and excessive alcohol use, per the CDC. As a result, researchers have known that a healthy diet and being physically and socially active can reduce dementia risk after age 65. Let's remember the word after age 65. Not after the or after an age, there's no article. So after age 65. But it wasn't clear if this also applies to young onset dementia until now, right? At the age of 65. Risk factors for young onset dementia. In the new study, the researchers investigated the association between 39 potential risk factors and the incidence of young onset dementia among 356,052 participants to understand how health, social, and environmental influences play a role. Of these risk factors, researchers identified 15 that were significantly associated with a higher risk of young onset dementia. Social isolation, lower formal education, lower socioeconomic status, carrying 2 copies of the APOE gene, vitamin D deficiency, hearing impairment, alcohol use disorder, no alcohol use abstinence, depression, high C-reactive protein levels, lower hand grip strength, physical frailty, orthostatic hypertension, a form of low blood pressure, stroke, diabetes, heart disease. Most of these overlap with the known risk factors for and behaviors that reduce risk of late onset dementia, the study authors wrote. What does it mean? Most of these overlap with the known risk factors and behaviors, right? The for is mistakenly inserted in the sentence, right? Most of these overlap with the known risk factors and behaviors that reduce risk of late onset dementia, the study authors wrote. We were surprised by just how many risk factors for dementia in elderly people were also important in people who were middle-aged, says Llewellyn. The study also identified several risk factors for young onset dementia that had not been reported or studied before, the researchers wrote, including social isolation, vitamin D deficiency, orthostatic hypertension, and high C-reactive protein levels. Researchers found that participants who saw friends or family once a month or less had a higher association with young onset dementia, suggesting a link between isolation and cognitive reserve. Vitamin D is important for building bones, immune function, and brain health, and getting enough of it may reduce the risk of young onset dementia. It has been suggested that vitamin D acts as a neurosteroid that protects against neurodegenerative processes, the study authors wrote. High CRP levels in the bloodstream are a sign of inflammation. According to the Mayo Clinic, this was a new risk factor identified in the study, and CRP levels are significantly higher in women. High CRP levels. Orthostatic hypertension is a sudden drop in low blood pressure that happens when a person stands up after sitting or lying down, per the Mayo Clinic. The findings suggest it may increase the risk of young onset dementia, possibly by reducing blood flow and depriving the brain of oxygen, the authors noted. The 15 risk factors varied in importance, Llewellyn notes, but more research is needed to confirm how they rank. There may be additional risk factors that we still need to identify, he adds. Additionally, the relationship between dementia and certain risk factors, such as alcohol use, is complex. For example, both no alcohol and alcohol use disorder made the list of 15 key factors. Researchers found people with a diagnosis of alcohol use disorder had a higher risk of young onset dementia. However, moderate to heavy alcohol consumption was associated with a lower incidence compared to abstinence. However, moderate to heavy alcohol consumption was associated with a lower incidence compared to abstinence. This may be due to the healthy drinker effect, in which people who drink are healthier, while abstiners abstiners, I think, what's the pronunciation, man? I get confused. Abstain, right? Abstinence, abstainers.
Abstainer.
Abstainers.
Abstainer.
Abstainer.
Abstain. Abstainer.
Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Abstainer. Absta abstain from, right? Abstain.
abstain,
여러분 잠깐만요. 차 있으신 분들은 이거 진짜 한번 써보세요.
41 2에 7792 차만 보면 되니까
I'm gonna feed. Abstinence, right? Abstinence. Abstinence, right? Abstinence. I was confused. Researchers found people with a diagnosis of healthy drinker effect, in which people who drink are healthier, while abstainers are more likely not to consume alcohol because of poor health or use of medication, the study authors wrote. Ultimately, the findings suggest that many risk factors for young onset dementia are controllable, and addressing these through lifestyle changes may lower a person's risk. There's good evidence that staying physically, mentally, and socially active may help to protect the brain as we age, says Llewellyn. In addition, try to avoid or at least carefully manage any health conditions that you have, he adds, especially high blood pressure, diabetes, and depression. We can be hopeful that a wide range of modifiable risk factors appear important. Thus, we can be hopeful that dementia can be delayed or even prevented, says Llewellyn. This article was originally published on today.com. So from this article, we learned such expressions as young or early onset dementia, abstinence, abstainers, alcohol abuse disorder, high CRP, right? Dementia is described as impairments in memory, thinking, decision making, problem solving, and so on. So Alzheimer's, Parkinson's disease, some other stuff are the examples of cognitive disorder or the dementia. So young onset dementia means you have dementia where people age 65. Here, age doesn't have any article, right? After age 65 or before age 65, per Mayo Clinic, according to Mayo Clinic, per Mayo Clinic, University of Baxter, Maastricht University, they are very renowned universities. Researchers, they need to rank the 15 factors. They were surprised that non-alcohol people are also susceptible to early young onset dementia probably because of the high drinker effect, right? Who are very active in drinking probably is healthier than non-alcohol people because they are taking medication or they are poor in health, so they cannot drink well. From this article, what expressions I learned? Yeah, they lay the groundwork for new prevention strategies. So let me go over the 15 factors one more time. Social isolation, lower formal education, lower socioeconomic status, carrying 2 copies of the APOE gene, vitamin D deficiency, hearing impairment, alcohol use disorder, no alcohol use, abstinence, depression, high C-reactive protein levels, lower hand grip strength, physical frailty, orthostatic hypertension, a form of low blood pressure, stroke, diabetes, heart disease. Heart disease, of course, diabetes, heart disease, diabetes, stroke, orthostatic hypertension, a form of low blood pressure, lower hand grip strength, physical frailty, high C-reactive protein level, CRP, depression, inflammation, basically inflammation, right? High CRP, depression, no alcohol use, abstinence, alcohol use disorder, hearing impairment, vitamin D deficiency, carrying 2 copies of the APOE gene, lower socioeconomic status, lower formal education, social isolation. This article was written by Carolyn Key. I wonder who she is. Sounds like Korean to me. Up next. That's it. Thanks all thanks to yahoonews.com and also Carolyn Key. And also I really appreciate your time to listen to my English practice. Please leave your comments, or I don't know, we could be friends if you're a good guy. Otherwise, don't bother to contact me. Have a wonderful Monday wherever you are. See you in my next video tomorrow.